Good afternoon, and welcome to your weekly 5-minute report. I'm Meg Walters, and this is my co-host, Anastasia Brown. In American culture today, it is common belief that we have a responsibility to protect and take care of our children. Currently, 20% of children population is in need of special care. Specifically, they are in need of mental health care. 1 out of every 5 children in the U.S. suffers from a treatable mental illness. Shockingly, it is estimated that 60 to 90% of children with a mental disorder go untreated. Anastasia, how is our country failing at its responsibility to take care of this vulnerable population? Why do these children not have access to mental health care?
Well, there are many barriers in the system causing a gap in mental health care access. Societal stigma on mental health disorders is a huge factor in the minds of parents and even youth. Many of these children are uninsured or there are restrictions on their insurance coverage. Also, parents, schools, and medical providers are missing opportunities of early identification and prevention. There is a lack of mental health care services and expertise for this age group. At the state and federal level, funding is also an issue in creating mental health care access for youth. Disparities and disproportionality among race, ethnicity, and income is evident in this issue. Children from low socioeconomic background have a harder time accessing mental health care. Lack of mental health care access for these children leads to poor school performance, school dropout, strained family relationships, substance abuse, and often run-ins with the juvenile justice systems.
The good news is several states are taking the initiative to address this issue. These states took into account what the children do have access to and where they spend most of their time. Schools are the one system that has direct access to almost 100% of mentally ill children. School health programs have shown to be helpful in identifying the mental health care needs of children. Children spend most of their time at school, and these mental health programs are accessible to students in low-income and underserved racial and ethnic minority groups. Now, let's go to Loretta Huckabee for more on the story. Loretta?
Thanks, Meg. Here in the state of West Virginia, we have chosen to approach this issue by building a comprehensive children's mental health program. West Virginia has developed an expanded school mental health initiative that funds 3 tiers of the mental health services: prevention, early intervention, and treatment services. The public schools of West Virginia collaborate with mental health professionals to provide children the mental health attention and access that they need. The state has changed its zero-tolerance policy, bringing a new approach to school discipline in support of the expanded school mental health initiative. This policy filters the students from being exposed to the juvenile justice system, many of whom were mentally ill students before the policy change. The state board now has guidelines on social-emotional learning standards that must be followed in dealing with school conduct. This state program promotes development and a positive school climate for its students. I'm Loretta Huckabee, reporting for the 5-minute report. Back to y'all at the desk.
Now to Connecticut. Here's Vivian Kennedy with more with the story.
Thanks, Anastasia. The state of Connecticut has implemented the School-Based Diversion Initiative in its school systems. The former zero-tolerance policy in Connecticut schools was leading to high rates of school arrest and expulsion. Many of these students have had behavioral and mental health needs. The School-Based Diversion Initiative was created to reduce the number of expulsions and exclusionary discipline practices, and to keep the mentally ill students out of the juvenile justice system. This initiative promotes the utilization of school and community-based mental health services and support for the student and their family. I'm Vivian Kennedy, reporting from Connecticut. Back to you at the desk.
Thank you, Vivian. With these states choosing to address the mental health care issue through school mental health initiatives, perhaps it is a sign of what is to come for the country as a whole. At the federal level, the Mental Health in School Act of 2013 and the Mental Health Awareness and Improvement Act have been presented to Congress. Currently, the federal government has chosen to put these pieces of legislation on hold and ultimately put the issue of mental health care access for youth on the back burner. Will the nation as a whole follow the lead of these pioneer states as more citizens become aware of the responsibility we have to the mentally ill youth of America? We shall see. We will continue to monitor legislative action and keep you informed in the months to come. I'm Anastasia Brown.
And I'm Meg Walters, and thank you for joining us.